Hi, guys, and welcome. Hi, Laurie. Thank you so much for joining me.
Oh, thanks for having me. It's always fun.
It's always great. It's always great to chat to you. Okay, so today, guys, if you're joining us live, we are talking fascia, and Laurie's presented a webinar for us this month on the subject. So this is kind of my way of digging a little deeper into that webinar, which I'm really excited about. If you guys have any questions at any point, please pop them into the comments. If you're joining us live, say hi. Let us know that you're here. We are here to be able to chat with you guys. So please join the conversation. Laurie, will you please introduce yourself and let us know what sparked your interest in fascia?
Sure. Dr. Laurie McCauley, graduated vet school in 92, did 6 years of general practice, got bored, fell down the stairs, went to a physical therapist, started the first rehab clinic because I'm like, oh my God, this is amazing. Taught the certification course for 14 years. I've been very blessed to be able to lecture nationally and internationally. I get to write book chapters and articles and blah, 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 blah. My mission is empowering people, whether it be a pet parent or a professional, to help dogs, right? That's my heart. That's my mission. And I started Optimum Pet Vitality 6 years ago, which is a continuation of my teaching. And fascia, I have always believed that things happen in my life, like falling down the stairs and starting the first rehab clinic, designing the first underwater treadmill. I fell on top of a mountain and broke my fibula. And the whole way down the mountain, because there was like nobody around, it was me, my neighbor, and my dog. I'm going, all right, God, obviously I'm supposed to learn something on how to help the dog. So what am I going to learn? And being board certified in sports medicine and rehab, I did everything to heal my ankle. I didn't even need surgery, right? It was just a non-displaced fracture, but the swelling was huge. I did acupuncture, chiropractic, physical therapy, PEMF, laser, ozone, CO2, massage, everything, and the swelling wouldn't go down. And my PT, who's a very smart man, said, Laurie, chill. I've seen this all the time. It's going to take a year to a year and a half for it to go away. I'm like, no, that's not acceptable. And I went to an osteopathy course, Patrice Corticus up in Oregon. She's amazing. And it just happened to be on fascia and inflammation. And she said, Laurie, I'll fix you. I'm going to use a tuning fork, clear your immune system, your lymphatics. And in 72 hours, 80% of the swelling will be gone. And within 2 weeks, the rest of it will be gone. And she was spot on. And I'm like, hyper focus. Oh my God. She comes to the US a couple times a year and teaches like 15 people at a time. I'm like, everybody needs to know this. And then I took that and said, okay, well, if I can do this with the tuning fork, what else can I do? And that started a whole cascade of learning and helping people help animals. And it's just super, super cool.
Okay, I love that when bad things happen to you, you take that as a learning opportunity and see how you can bring that into the animal world. That is amazing. That's like the whole never stop learning attitude, but with another layer added. So thank you. And thank you for teaching everyone else. That's a really interesting story. And I think that connection between the tuning fork and fascia, that's interesting. We're going to go into that more. So you spoke about this month's webinar that you presented is fascinating fascia, making it slide and glide. Can you tell us more about the slide and glide components of that title? What do those terms actually mean? Why are they important in terms of fascial health?
So let's think about what fascia is, right? So think about fascia like if you have a turkey and you're going to make it for Thanksgiving. I don't know if you guys do that in South Africa, but if you take a turkey and you want to put your herbs and your butter between the skin and the body wall, right? You're actually putting your hand through what we call soft fascia. So it is what helps the skin and the tissue slide and move so that we can move and we're not just stuck. If you look at dense fascia, it's what's around tendons, ligaments, muscle, and it helps hold things in place. So again, you have to have tendons slide over bones and muscles slide over different muscles. That's the interstitial space, and that's where fascia lives. So to give a visual, will you show the first slide, the movie of what actual fascia looks like?
I just realized that when you left and came back into the studio, I lost your share screen. So can you share your screen again? You're just going to hit that little screen button at the bottom of your page and select share screen.
Share screen, window.
There you go.
Share. There you go.
There we go. I've got it.
So this is actual fascia. So these are collagen fibers, and the little drops you see are hyaluronic acid. And you can see the fibers actually move, they slide, they glide on each other. Fluid, the metabolic waste, the toxins, that kind of stuff flows through that to the lymph nodes, which then go to the lymph ducts, right? And in our lymph nodes, they chew, the B cells and T cells, they chew up a whole bunch of stuff. And it just keeps going up until it comes up to the thoracic duct and terminal duct. And then it dumps into the subclavian vein, which goes into the liver and the kidneys, and we get rid of a lot of waste. But it's cool to see what fascia actually looks like. So here we go, stop sharing. Oh, actually, darn it, I shouldn't have done that.
That's okay. You can share it again.
Window, let's come here. PowerPoint share, because then I want to show you this. So this is fascia over healthy muscle tissue. You can see it's holding the blood vessels. It's glistening. It's nice. Here's fascia over a tendon that's sticky icky. Here's fascia that has fat. So you can get metabolic waste, toxins, fat, just icky stuff, right? For lack of a medical term, in there that's not going to allow that fluid to move through. Instead of having beautiful hyaluronic acid in here, right? We get this kind of stuff, Okay, now I can stop sharing.
Okay, no, don't put it back up.
Put it
back up, please. I want to look at that some more. It's really cool to see the blood vessels within that fascia, because they're showing that crimp pattern, which tells us that like they need space to go somewhere. Like they're gonna lengthen, not go somewhere. They're gonna be able to lengthen because they have that crimpy pattern. That's really cool. Okay, and by sharing these, you're talking about like a lot about the waste, the metabolic waste movement through the lymphatic system. That's actually not something that I've explored with regards to fascia. So now you've taken me down another rabbit hole, which I love. Okay, guys, if you have any questions, pop them in the comments, because we're here to chat together. And this is really interesting. Okay, now I'm going to remove that, and then we're good.
Okay. So think about this. You saw the fascia crimping and crushing, compressing the blood vessels. It also does that to the lymphatic ducts, to the nerves, so it can create pain, right? And by releasing that, we increase blood flow, we increase perfusion, we allow the immune system to work better because it's not compressing the lymphatic ducts. We're decreasing pain because we're taking pressure off of the nerves. So it makes a huge difference.
Okay, I like that. So that visual thing that we could see with the blood vessels, that's the same thing that's happening with nerves and other tissues. Okay, I love that. I love that. All right, so a big part of our job, like one of the big things that we talk about, is improving mobility, which essentially comes down to like improving joint mobility or the extensibility of your muscles or whatever that might look like. And we're usually thinking about that in terms of a specific tissue. But when we're treating from a traditional physiotherapy point of view, a limitation in end of range, then we're usually taking that tissue to the end of range and then practicing or pushing against that limitation, right? Does fascia, are we going to treat fascia the same way if we're trying to improve mobility, improve movement, or slide and glide? Do we take it to the end of range and then move it in that end range, or are we doing something different?
Yes. So there's multiple ways that we can work with fascia, right? So to give you an example, they took rodents, rats, and they injected them with cancer. and they gave half of them they did nothing with, and half of them they taught them how to stretch, and they stretched on their fascial lines, and those rats had significantly less metastasis, right? So we know stretching fascia helps. We know that when we stretch fascia, like a tendon or ligament, we actually increase ATP production in the fasciocytes, right? Because you have multiple kinds of cells that are in there. And it lays down more collagen, which are the collagen fibers that we want, the nice clean things. It increases ATP. It sends messages out. We see fibrocytes in there, fibroblasts in there. And we have more hyaluronic acid being produced. So the healthy stuff is being generated when we are taking that fascia into full stretch. You think about like Ida Rolf, who is the first person to talk about fascia. And she said, okay, well, we're going to stretch it and compress it. And she got results. Like I have a dear friend in Hawaii that I just was working with and teaching her some of the things that I do. And she's like, oh my God, I feel so much better, but I didn't have 3 days of pain from the Rolfing. Like, yeah, that's what this is all about. We can do it without the pain, right? Or we think about acupuncture needles. You stick a needle in and you twist it. And what it's doing, we have electron microscopy that shows that the fascia is grabbing onto that needle and the fascia is being twisted. So it's affecting, and remember, there's not like fascia here and fascia there. It's all connected. The whole body is connected. We have fascial lines where it's more dense, but it's all connected, so it can have an effect in different places. And then the tuning fork I love, because I can take people, and one of the things I have them do, and you can't see very well, but I have them put their arms out and then stretch their arms straight back. And I will, thank you, there we go. I will say, okay, look to the left and to the right and see which arm goes back less far. So they take the one that goes back less far, and I like put the tuning fork here, and then under the pad of each of the 4 digits. And literally, as I'm doing that, their arm starts going way back, right? Because we're releasing
you do that. You do that in the extended position.
Yeah.
Huh.
I
okay.
Into stretch, and then I put the tuning fork on the end of the fascial lines, and that allows it's crazy. That's what I'm telling you. This is so crazy cool. Yes.
Okay. Are those you've said they're the end of the fascial lines. Are they specific points? Are they actually are they acupuncture points that do they correspond to the traditional acupuncture points?
Yes, no. So yes, no. So like I took Patrice's courses, and she said, here's the special points. And I read the myofascial book cover to cover from the people who've done the dissection for the fascial lines. And they have totally different points. And then I'm like, okay, well, I have 1, I have 2. So then I started playing, and I said, okay, well, let's find out if I'm doing this. And does this work?
This points in this book? These points?
Yeah. So right,
okay.
Right. That's I can't see very well, but that's
it's
like
the, it's the equine one. I still need to get the canine one. I will.
Okay. So I read cover to cover the equine one. I read cover to cover the canine one, and there were still times that I didn't have a release. So I'm like, okay, where do I put it on the dog? So then I'm like, oh, if I do it here. So one of the things is I mapped out, if here's the problem, if I'm working on this line, it can be this point, and this point. And what's super, super cool is instead of like saying, I'm going to put a needle in here and it works or it doesn't work, we use slide and glide or sticky icky. And the tuning fork tells us if it's the problem area. And if it's the problem area, the tuning fork fixes it. And then what
do you mean the tuning fork tells you? What does that mean?
All right. So here's my tuning fork. Right. I have a whole set of them. But this one has amethyst. I don't know if you guys can see. It's purple, right? Yes. Amethyst is considered a natural healing stone. It's 128 hertz. So that is considered the frequency of fascia. I've tried other frequencies on fascia and it doesn't work. But with this frequency, I can, and with the amethyst, I can come in here and I just activated it. I don't know if you can see it's vibrating. If I put it on my hand, there's no fascial restrictions. Can you see how it slides and glides?
Okay, yes.
Okay. If I do the same thing and put it on my neck, Can you see how it grabs? It doesn't slide. And if I let the tuning fork sit here, it's going to release that fascia. And then let's see.
It just like gets stuck and then you hold it there.
Totally stuck. And then you do this until the fascia is done. Okay, so now it slides and then it gets stuck here. And I would do that.
You are kidding.
I'm not kidding. Right? And now it's going. Now it's sliding because I got rid of the fascial restriction. It's crazy.
Okay. Now, does that translate to dogs? Like they have a coat.
Yeah.
Does the coat make a difference?
No,
long coat,
not at all.
coat.
You use a little bit of pressure, right? You can't just slide over them. You have to use a little bit of pressure. And physics-wise, you want as much of the surface of the stone to be touching, right? So if I'm at a very steep angle, it's just going to slide. But if I have a significant amount of the stone touching, it will grab.
Okay, so you want to be perpendicular, and then you want to depress the tissue just enough so that the tip of the stone is
so that you can feel.
Yeah.
Yeah.
Oh my goodness.
It's so crazy cool.
What is this magic? I love this industry that we're in.
It's cool.
Okay. We have a question or a comment. I'm going to just read it for us. Used my tuning fork this morning after an hour drive to the hospital that I'm working at today. Such a lovely method of care. I also have had significant strength increase with my neuromuscular reset physiotherapist, who bases a lot of his work on the anatomy trains. So he works on the pelvis to help my shoulder.
Excellent. Yay.
That is amazing. Okay. Thank you. Thank you, Margie, for sharing that. Guys, if you have any experiences to share or questions, pop them in the comments because we do want to be having a conversation with you. All right. So we've spoken about tuning forks. Is this your favorite method of treating the fascia?
Yeah. Yeah. I mean, I still use my hands. Don't get me wrong. Right. So like if I am, I mean, I'll always do cranial sacral, right? So that's the fascia around the brain, and I'm working on the meninges. But if that doesn't work, right, the tuning fork is right there. So it's everything is multimodal with me. It's not like I've given up everything else. It's like saying, wow, antibiotics are amazing, but I'm not going to give up the rest of my medicine cabinet, right? But it is an amazing tool.
Okay. So what has been like one of the most surprising things that you've seen using the tuning fork? You've already told us some really cool stuff. Is there something that stands out for you?
So like I'm always learning. So when I go to any conference I go to, if I'm lecturing, I will also vend, which means I'm telling people about optimum pet vitality. And I take the tuning forks and I say, how can I help you? Because that's how I learn, right? Is I learn on the people and then I take it to the dogs. And I'm like, yay, it works. I have had a cowboy. So I was at the Minnesota Veterinary Medical Association, and he's an equine veterinarian, right? He's tough. And I said, how can I help you? And he's like, well, I got knee issues. I'm like, okay, let me work on one of your knees. And I used the amethyst, which is for the fascia. And I used lapis, which is one of my other favorites, which is blue, lapis lazuli, right? That's my color, blue, right? It's who I am. And that's for scar tissue. And between the two of them, I spent like 10 minutes going around finding anything that was sticky, icky. Because, okay, I'm going to blow you away for a second, and I swear it's true. I can take, if there's a fascial restriction, it will be sticky with this one. If there's scar tissue, it'll slide right over. If there's scar tissue, it'll be sticky with this one. And if it's a fascial restriction, look, I can go all day long on my neck. I have no scar tissue in there. I spent 10 minutes on this guy's knee, and he stands up and he bends his knee to 90 degrees. And I'm thinking, oh, wow, I didn't help him that much. He started crying. Tears literally came down halfway down his nose. And I'm like, he's going to be really embarrassed. So I'm like, start talking really fast and turning away. And so that he's like, oh my God, I can't tell you the last time I bent my knee this far. Right?
Wow.
And then we think about how do I translate that to the dogs, right? You take a dog who can't bend their hock or they can't bend their knee, And if it's bone, I can't change it.
Mm-hmm.
But if it's scar tissue or fascia, I absolutely can.
That gives me goosebumps. I can't even imagine. That's
Yeah.
wild.
And it's not like
Okay.
it's one piece, right? I see it, validation, right? How do I know I'm doing a good thing? Again and again and again, it's helping people and animals.
Yeah. Yeah. Okay. I have a lump in my throat now. So let's talk about the evidence, because there must be something. What does the evidence currently tell us about using vibration to influence fascial tissue?
So we know, it's one of the reasons I call it acoustic therapy, because we're
Mm-hmm.
used to, like in rehab, shockwave, right? Shockwave is using acoustics to go through the body. Ultrasound, right, is using sound waves, and different vibrations will give us different images, right? Or have different effects in the body. So we know acoustic therapy. I can't tell you how many people I will put the tuning fork like on their shoulder and they'll say, wow, I feel that down to my hip or to my toes. We know it goes through the body, right? Science-wise, I have done an extensive lit search. I have been teaching using the tuning fork on the VIN. For the last 16 years, I've been one of the instructors for the VIN. You're familiar with VIN? Yes?
No.
Okay, so Veterinary Information Network. It's a
Okay.
continuing education group. They've got over 60,000 veterinarians in there. And every year we teach the pain management course. There's like 8 of us that teach it. And for the last 3 years, I've been teaching on this. So I have done an extensive lit search. Mary Ellen, who is their researcher, has done an extensive lit search. And there is minimal research on using the tuning fork for fascia or pain or anything like that. There's a lot for hearing, but not for using it on the body. So I have to be very careful when I say what it does, right? I have 2 board certified sports medicine and rehab veterinarians that are starting a research project right now, looking at getting rid of scar tissue, because using the lapis, I can tell you Sid's story. So
Yeah.
things happen to me for a reason. Oh, he's not behind me. He's usually right behind me. So Sid is my amazing dog, right? He's one of only a few dogs in the world that can jump on a round ball, walk it forwards, backwards, sideways, spin and twirl with nobody touching it, right? He can do sit up and bag or bag stand bag, which is a hard exercise, 60 to 80 times in a row, right?
That's gracious.
He's strong. He had emergency abdominal surgery. We thought he had a foreign body. Thank God he didn't. I was in and out. I came back from lecturing and his incision had gotten infected. There was an abscess. There was scar tissue. Literally, he couldn't do sit up and bag. The scar tissue was pulling his body down. And I'm like, crap, what do I do? I lasered it. It helped a little bit. I did the PEMF. It helped a little bit. I grabbed my amethyst tuning fork. It helped a little bit. I'm like, what do I do? What do I do? And I'm like, okay, lapis. Lapis is for scar tissue. I swear to God, within 8 minutes, the scar tissue was totally gone and he had full range of motion again. So things like that just blow me away. And like, people need to know about this because it's not expensive, right? It's not like your laser that can be, anywhere from $5,000 to $35,000, or your shockwave. And we can have it. Don't get me wrong. I would never give up my laser, right? My laser can cause my chondrocytes in my cartilage to produce more cartilage, right? My tuning fork, as far as I know, is not going to do that. But can it get rid of the fascial and the scar tissue? Absolutely.
Yeah. No, that's really powerful. Okay, so you've just mentioned that there are some vets who are starting a research project, and this is one of my favorite questions to ask people at the moment. Do you have any ideas for research? Like, if you were to do a research project to try and show the effect of a tuning fork on fascia, what would that look like? How would you set that up within your clinical practice, within your life? Like, is there a way that you could do that?
Oh, it would be easy. So I don't want to take away from what they're doing because they're doing the scar tissue thing. But if you're looking at stretching fascia, it would literally be, let's check animals that have range of motion restrictions secondary to fascia, use the tuning fork both locally and at the end points, or the points that I've identified as, if you use it here and it's sticky icky, it makes the issues go away, and then measure range of motion after.
That's it.
That's it.
Okay, there we go. Okay, so are you going to do that research project?
Hell no. Sorry. My plate is so full.
Okay,
let's do
in
that.
that case, to those of you who are listening who want to do research, get in touch with Laurie and let's get some evidence in this area, because why not? Yeah, why not?
Absolutely.
Okay. So for someone who's never used vibration in their rehab program, where would you recommend they start?
Learning about it, getting the tuning fork, going through the course, excuse me, and playing with it, right? It's easy. It's a game changer, right? You can have systemic effects, simple things like, I teach my clients to take the amethyst, right? Because it works on fascia, and go down the bladder meridian, right? Just either side of the spine, between the first two sets of muscles, and the gallbladder meridian, right? Because so many times dogs have neck issues. And if it's sticky icky, stop, let it do its thing, clear it, and then keep going. You can laugh. I've done heart surgery on like a 12-week-old puppy, and I'm needle phobic for myself. Okay. So when I go to my acupuncturist, she needles me, and then she takes a Sharpie and puts dots on me, and then I can go home and use my tuning fork to stimulate those points, so I don't have to stick needles in myself.
Okay. Okay. I wouldn't stick needles in myself either. No. Margie, can you expand your question, because I'm not 100% sure what you mean? And Sue, thank you for joining us. I'm glad to see you're here. Sue asks, how do you add the stones to your tuning forks? I have a set, but mine is quite narrow on the end. I was also curious about that. How do you add and change the stones?
There is a, let's see if I just, a little spot with a screw, and the tuning fork and the tips both come with an Allen wrench. So you put it in, it's a half turn, this one comes off, you put the next one on. Tighten it.
Okay. So do you have a set of tuning forks with the different tips, or do you change your tips?
I know you have lazy. I am lazy, right? Because I have my little bag, right?
Yeah.
That has all of my tuning forks in there. And then all of them have, you can laugh, but they have nail polish on the top, right? So that's yellow. So that's for my honey agate. Green is for my aventurine. Brown is for my carnelian. I have rose quartz. I have tiger eye. I have clear quartz. Let's see. I have my rose quartz. I have my red jasper. I have my sodalite. So they each have their own, so that when I'm working, they're just laid out and I can just grab what I need.
Okay. Okay. You've got all of them with their own tips. I like that. And this is a great place to interject that you actually have a cheat sheet on what the different tips are for. So I'm popping that link into the chat right now. Guys, check the comments. Did I just, that's just a link on YouTube. Sorry, it looked like a video and it's not a video. It's just on YouTube. So go and get that sheet. Can you give us like a little breakdown of what the different tips do?
All right. So I have to grab them to think about it. So red jasper is a mover and a shaker. So to give you an idea, I worked on Beth Miller, who's a vet tech, who super, super lady. And she came to me 3 years ago, and said, I had kidney stones and they did the lithotripsy, but it still hurts. It's been hurting for like 6 months. And I used this on her and she's like, wow, the pain's gone. I'm like, great, think nothing of it. I saw her at the Minnesota show. No, she was in Ohio. Sorry. She was at the Ohio show. And she's like, yeah, I never had any pain since that. Right?
No way.
Yes. Right. So red jasper, it does not go deep, but it's big where it's at. So like a tendinopathy or something like that can be helpful. How do you know? Because it's sticky icky over it. If it's not sticky, it's not going to help. We talked about amethyst, right? Because that is and trigger points melt with amethyst. We talked about lapis. We've got sodalite over the heart chakra is amazing for getting rid of PTSD. So think of dogs or horses, right? Because I've got vets who use these on horses who've had some kind of trauma in the past, or even just coming from a humane society. It releases that. I've had people where we put it on and they start crying. We've got the rose quartz, which we'll use after that. And it's love, it's joy, it's healing, it's sweet, it's calming. So let's see.
I love rose quartz. That's one of my favorites.
Tiger eye. Tiger eye is it's not even on our website yet. It's coming soon. It is for fear, and it's fear-based anything. So I've had it like diarrhea, and you can't get rid of the diarrhea, and you use this, and it's like a fear-based diarrhea, right? Or a fear-based incontinence, urinary incontinence, or fear-based scar, like Sid. One of the reasons I know about this is he got chomped by another dog, and I couldn't get rid of the scar tissue in the back of his neck. There was just restrictions. And I used this, and then again, what I have been doing again and again with the amethyst and the lapis, and I'm like, it's just not going away. And there had to be a fear component. We know, right? There's lots of studies in humans that the fascia can hold emotions.
Yeah.
Right. So sodalite is an emotion for trauma, PTSD. That is huge for fear.
That is really, really interesting. So we're doing a lot of talk about the nervous system right now. And that is making me think about like something stuck within the nervous system, because so often fear and anxiety can come from a root of pain or trauma and then get stuck. Where is that? I don't know. The nervous system, the fascia, it all makes so much sense. So that is really interesting.
It's crazy. It's cool. I have honey agate. So quick story on that. I was at the AVCA, so the American Veterinary Chiropractic Association. So I had a chiropractor come up to me and I said, how can I help you? Right. I always open myself up to that. And she says, I've had hemorrhagic colitis for 12 weeks. And I'm like, I'm a rehab vet. What am I going to do with that? And I'm like, okay, honey agate's good for GI issues. So sure enough, we put it on her like solar plexus, we call it the GI triangle, right? And it's sticky icky. And it took like 20 minutes to get it not sticky icky. And the next day she comes and she's like, oh my God, Laurie, I'm so excited. I had to tell you. I'm like, what? She's like, I did the skinny dance last night. And what do I know, right? I don't do humans. I'm like, huh? She's like, I had pizza for dinner. I'm like, okay. She's like, wow. The first time in 12 weeks, I had a meal and did not look like I was 9 months pregnant.
Wow.
Right? Wow. I'm telling you, man, this stuff is crazy cool. Who else do I have?
That is very cool.
Yeah. So I know we got a bunch of questions, but yeah, I mean, they're like my friends.
Yeah. Okay. I love that. Margie, I'm very happy for you to use the comment section as notes. They're going to stick around. So you can come back to your notes afterwards when you need them. Okay. So let's see. What else do we need to get? Guys, if you have any questions, please post them in the comments because we're going to answer them and chat about them. Let's talk about other ways that we can use this. So this is really about like the vibration and the frequency of the stones. And so they have different effects because they're doing different things. Do you want to say more about that? Because I don't necessarily understand. Okay.
I'm a scientist. And when I first heard about that, I'm like, it's a stone. It's round. And I locum at LSU at the vet school. And one of my colleagues down there is like, Laurie, I study stones. They all have their own chemical composition. They all have their own hardness. It makes total sense that the energy coming through that would be changed. So we know, right? Because I'm anal retentive. If I take a tuner, it's still 128 hertz. Yet, if I put this tuning fork on you, and then I take this tuning fork and put it on you, it's going to feel different. You literally can feel the difference between the different stones. So if you can feel the difference, it would make sense that it could have a different physiologic effect in the body.
Okay, so the stone is changing what? Changing the frequency?
It's not changing the frequency. The frequency
No,
stays the same.
the frequency is the same.
It's
So what
somehow
are we
the
changing?
energy. You want I know it changes the physiological effect, but I don't know how. I wish I did.
Okay. I mean, I'm quite comfortable not having the answers to everything. If we can see a change and we can see the effect, then life is a mystery, and that's wonderful and exciting. It would be very boring if we knew everything, right? There's room to know stuff. Maybe
Can
that's another research project, is like, what is changing? How do we what is changing when we change this stone? What happens?
One of the things that helps me is, you've probably heard of people taking lithium for like psychotic issues or like anxiety and stuff like that. With all the research, nobody knows. They have no, and lithium is a stone. They have no idea what the mode of action is, and yet we've been using it for hundreds of years.
Okay, interesting. Okay.
I know.
All right, so you mentioned, like, when you're treating the fascia with the tuning fork, you're generally going to specific points. Okay. Can you also use something like your laser to activate those points, or potentially
Oh,
like
absolutely.
pressure, because not everyone has a tuning fork? How else could you work with that?
Absolutely. So I don't have shockwave, but I use my laser all the time. And I will tell you, there are times where my laser isn't working to fix something and my tuning fork will. And there's times where I use my tuning fork and it's not fixing something and my laser will. So I am a huge believer in multimodal therapy, right? My goal isn't to use one tool. It's to help the animal to the best of my ability.
Do you use your laser in a similar way to the tuning fork, where you slide it across the tissue and find a restriction or an area of getting stuck?
So I've been studying laser for 20 something years, right? I taught it for the rehab certification course. I've got hours of lecture on it. Right. The laser course literally is 20 hours race approved CE. My role, my thought process is, we know that if we put a lot of energy in, we literally are stopping ATP production in the cells, which is not good if you want healing, but it's great if you have pain. Right. So we know that we can decrease fibroblast chemotaxis and decrease ATP production, so that we're literally creating like an axonal, so a nerve block from that area. We know from the research that if we give smaller amounts of energy, we actually speed up cell respiration, mitochondrial respiration, and we get more ATP production and more fibroblast chemotaxis, so that we're getting more healing to the area. So if my goal, and I always ask people when they ask me, what should I do? It's like, well, what's your goal? If my goal is I need to stop the pain, I am going to hold it in one place with a 3B. Obviously, you can't do that if you're using a 970 or 980. You have to scan. But if I'm using a 3B, something in the 800 range, 904, 905, 600 range, in one place if I'm treating pain, and scanning if I'm trying to do healing. So when I'm scanning, I'm giving a little bit, coming back, giving a little bit, coming back. So I'm stimulating that healing process more. So that's a long explanation.
I've done your laser course because I really wanted that, so I got that for myself a couple years ago. You're such a fantastic teacher. Yes.
Thank you.
A fantastic educator. So if people want to learn more from you, where do they go? What do they need to do? You've got an awesome discount for us, so I'm going to share that as well. But tell us about your tuning into your dog course. Yeah.
Yeah. So when I first started the tuning fork stuff, I thought, oh, nobody's going to want to know this. And then I'm like, okay, I'll make a course. And like I said, we've had about just over 900 people go through it.
Wow.
On Pet Vitality. I know it blows me away. Right. And so many, one of the, Heather Mack, who's a friend of mine, she called me for advice on her dog. And she's like, I sent her the tuning fork. I said, take the course. And she's like, can it work on horses? I'm like, of course. Horses are super sensitive. And her words to me, and I asked her if I could repeat them, right? Because it's a direct quote. I feel like I have a magic wand and I haven't been to wizarding school yet. Isn't that the best quote? I'm like, oh my God, so cool. So Optimum Pet Vitality is my teaching platform, our teaching platform. It's never about me. It's all about the dogs. We have multiple courses. The one on the tuning fork is tuning into your dog. It's for both pet parents and vet professionals. Hint, hint, at the end of the year, we're going to be coming out with Tuning Fork 2.0, which is going to be a lot more medical stuff, right? It's all the stuff I've learned in the last 3 years. So that's coming. The tuning into your dog is for both professionals and pet parents, because I made it simple so people could learn it and use it and help the dogs, right? Because that's what I'm all about. We do have a code for you guys. It's OLPH for Online Pet Health 20 for $20 off. When you buy the course, when you purchase the course, if you're in the United States, we will mail you a high quality tuning fork with the amethyst tip, because I have ordered them from Etsy and eBay and everywhere else, and I can say it, they suck, right? So if it's not the right metal alloy, the vibrations don't work. If it's not weighted appropriately, the energy doesn't come down. And literally, I get them from Tibet, where I know the stones literally don't get cut until I call and order. So I have to order like 200-300 tuning forks at a time. And I call, they contact the guy in Tibet. He carves the stone, he puts it together, and 3 months later, I get a shipment. So quality is super, super important to me. I never wanted anybody to say, I took Laurie's course and it didn't work, because they didn't have high quality equipment. We can't ship it outside of the US because of tariffs. And I'm sorry, anybody who's outside of the US, please, the people here are not our government. Remember that. Don't stop liking us.
Good point. Yes, good point. Is there, so if someone is outside of the US, do you know where we could buy them? Are there any? You don't? Okay. You don't have any recommendations. That's sad.
Sorry, I wish.
Okay. All right. I have posted the link to the Tuning Into Your Dog course in the comments so that you guys can see that. And the code OLPH20 for $20 off. So get that and enjoy. And I hope that you guys learn so much. I think this is one of the coolest things that we have at our disposal. It's simple. For me, it's like kinesio tape. It's not expensive. Once you have it, once you have the skill, it's so versatile. There's little that can go wrong. It's just a fantastic tool. I can't really compare it because I don't have a tuning fork and I don't know how to use them. So, but it feels the same way.
So real quick, I think I am the first person who is using the stones with the tuning forks for physiologic change in the body. So I want people to know that that's why I wish I could give you even more information, but I'm still learning every day. And you said you can't do anything wrong. I've had 2 instances. One makes total sense. Back 50 years ago, they can't do it anymore now because people would be so happy. But it used to be when I was a kid, if somebody had a bone and they didn't know if it was fractured, they take an x-ray, they can't tell, they would put a tuning fork on it. Because if it's not broken, you say, yeah, I feel the vibration. And if it's broken, it's excruciatingly painful because the pieces are vibrating in different places and really, really, really painful. So don't put it on a fracture that is not stabilized. And the other thing is I've had only 2 cases, but dogs who've had shock collars where they get a vibration before the shock that get the vibration of the tuning fork and flip out, right? So I've only, like I said, I've only had 2 patients, and I've had lots of patients who've had shock collars before that have no problem, they just melt with it. But I want people to be aware.
Okay, that's worth keeping in mind. Is there anything else that you want to share with our listeners?
I wouldn't put it directly over cancer, right? Because if we are increasing blood flow, I don't want to. I would not want to increase blood flow to a tumor. Yeah, I do. You guys are rehabbers. Do this, play with this, and let me know what you find. I have one of my friends who taught me how to fix or it significantly improve laryngeal paralysis, right? With the tuning fork. Yeah, right? There's so many things now. Mm-hmm. So yeah.
Okay. We do have a question from Anna. Anna, usually we don't answer specific patient related questions, but Laurie, I think that, I mean, are you happy for me to give it to you and then
Sure.
you can see it? Okay, cool. What could help a 6-year-old German Shepherd mix who developed urinary incontinence at around 2 years of age, shortly after having a litter and then being spayed? Initially, she only leaked urine when deeply relaxed or sleeping, but the problem has persisted.
Thoughts on that? So supplement wise, Standard Process has a product called Simplex F, which is for female incontinence. Now it's for humans, but I've used it with patients before. Supplement wise, I think of Colidin, which is choline, right? So one of the major transmitters that controls bladder control and expression is acetylcholine. So supplementing choline is the precursor to acetylcholine. I always tell people my rule for incontinence, especially spayed female incontinence or postpartum incontinence, is you try it at the recommended dose for a week. If that doesn't help, you increase it by 50% for a week. If that doesn't help, you double the recommended dose for a week. If that doesn't help, acetylcholine isn't your problem, right?
Okay.
But if it is, then you titrate down to the lowest dose that's going to continue to help her. If it's a fear related, oh my God, it was a horrible, painful, scary birth, maybe the tuning fork could help, right? And then that would be a honey agate tip, because I would try both honey agate for the bladder itself, right? Because honey agate's what we use for bladder. Ooh. So what I would try, right, to see what's sticky icky, aventurine, which was one of the ones I didn't talk about, is for nerve and my organs. So kidney, spleen, liver, intestine. I would try honey agate. I would try aventurine. See if it's a fascial restriction or a scar tissue restriction. So amethyst and lapis, and see if any of those are sticky. If they are, it's probably going to help. If they're not, it won't. And then my tiger eye, if it was fearful, right? I don't know what caused it, but those are the things I would try.
Okay. I think those are some very good thoughts. Thank you. Thank you. All right, guys, if you have any other questions, feel free to pop them in the comments or experiences. If you've been working with tuning forks, I would actually love to know that. So please add that to the comments as well. We want to know that. And let me know what you guys think about the course when you've signed up, if you sign up. Laurie, thank you so much for your time. It's been really great chatting.
Oh, you're welcome. Thanks for having me.
Awesome. Oh, and of course, Dr. Laurie's webinar is in the online pet health members portal now on Fascia. So that will be available to our small animal members anytime you want to watch it. Okay.
Awesome. Thank you.
Have a great day, guys. Bye.